Imagine using something you probably use every single day.
Yeah.
Yeah, WhatsApp, not just for chats, but to actually tackle a massive global health issue, one affecting millions of kids.
It sounds almost too simple, doesn't it?
Right. But today, we're diving deep into something really interesting called Noura-Bot.
That's it, Noura-Bot. It's essentially an AI-powered chatbot, and it's specifically built to help with, well, the early identification of child malnutrition.
An AI chatbot on WhatsApp for malnutrition.
Exactly. It's a pretty innovative way to go about it, using tech that, so many people already have right in their pocket.
Okay, so fundamentally, it's a chatbot you talk to on WhatsApp, you give it some info, and it gives you a sort of preliminary idea about a child's malnutrition risk.
It's the core function, yeah. Preliminary check.
And for this deep dive, we've gone right to the source material information straight from Nourasense, the company behind Noura-Bot.
We've looked at their welcome message, what users first see, and also a launch announcement from the CEO and co-founder, Kelvin Songwem.
So our mission today, for everyone listening, is to really get under the hood. How does this tech work? Why is it potentially so important? And what could it actually mean for child health, especially, in places where getting healthcare isn't always easy?
Okay, sounds good. Maybe let's start with the why. The problem Noura-Bot's trying to solve.
Yeah, the scale of it.
It's huge. Nourasense points out over 45 million children under 5 suffer from wasting.
Wasting, okay.
And more than 149 million are stunted because of malnutrition. Every single year.
Wow. Those numbers are staggering. And it's easy to just see them as statistics, but like Kelvin Songwem mentioned, this is the reality for so many families day in, day out.
Absolutely. And a big part of the challenge is spotting it early. The initial signs. They can be quite subtle.
Not always obvious, right?
Not at all. And they might get missed until things are already pretty serious.
Which brings us to the difficulties in actually identifying it early on.
Yeah, think about the practical stuff. For lots of people, the nearest clinic could be, miles away, long journey.
A real barrier.
Definitely. And healthcare workers, often completely overwhelmed, stretched thin. And even well-meaning parents might just not have the, specific knowledge or the tools to catch those early warning signs. It's complex.
So many factors involved. Okay, so given those challenges with traditional healthcare access, a solution that kind of meets people where they are on their phones sounds really promising.
That's the idea.
So tell us more about Noura-Bot itself. How does this WhatsApp thing actually work?
Okay, so it's an AI chatbot living entirely inside WhatsApp. No separate app. Its main job is to help with diagnosis, analysis, reporting, all related to child malnutrition.
Diagnosis, analysis, reporting. Okay.
And Nourasense is clear. The main focus areas are Asia and sub-Saharan Africa, places where the need is often greatest.
Makes sense.
And what's really interesting here is the AI aspect, the scalability. Imagine training it on huge amounts of data, local data on malnutrition signs, things maybe an individual health worker might not spot across a whole population.
So potentially catching trends or patterns earlier.
Potentially, yeah. At a larger scale.
What really jumps out from their materials is how easy they want it to be.
Oh, definitely.
The CEO literally said, if you have WhatsApp, you have Noura-Bot.
Simple as that.
The fact you don't need to download anything extra or the tech savvy, that feels like a massive plus for accessibility.
Huge. The low barrier is absolutely key. Their welcome message shows just how simple it is. Step 1. Just send hi to their official number on WhatsApp.
That's it, just hi.
That's it. That kicks things off. The bot replies, like instantly. Welcoming message, clear, simple options, no confusing menus or anything.
Sounds very intuitive. Okay, so after you send hi, what happens then? How do you actually, use it day to day or whenever you need it?
Well, the bot then leads you. It gives you prompts, really easy to follow. You get options like tracking your child's growth, asking about common health worries, setting reminders for checkups, even getting parenting tips.
Quite a range of support.
Yeah. And you just reply by typing the number or the option you want. Super straightforward.
It's almost like having a little health assistant right there on your phone, ready whenever. And I liked that little extra tip they included.
Ah, the hi again tip.
Yeah. If you get stuck or lost, just type hi again to reset. It shows they've thought about the user getting confused, trying to make it frustration-free.
Exactly. User experience seems really central. And what's pretty amazing is what it can do after just a short chat. Nourasense says less than 5 minutes.
Under 5 minutes? Seriously?
Yeah. After that quick interaction, it can give you that preliminary analysis of the child's malnutrition risk.
That is incredibly fast. Wow. And it doesn't just stop at the analysis, right? It gives you more.
Correct. It also creates a simple, clear report, something you could easily share, maybe with a health worker later.
Okay, a shareable report.
And it gives recommendations too. Next steps, follow-up actions needed.
Got it. But it's important to stress, and Nourasense stresses this too, this isn't replacing doctors or nurses.
Absolutely not. It's positioned as an initial screening tool, a way to flag potential risks early, especially if getting to a clinic right away is difficult or delayed.
A first step, maybe?
A first alert system, perhaps?
Okay, and the tech behind it. It must be more than just simple pre-programmed answers, I guess.
Oh yeah, definitely. It's a blend. Sophisticated AI, established evidence-based pediatric guidelines.
Okay, so based on medical knowledge.
Right. Plus, Nourasense's own proprietary health models, which they've developed through, research and actual field testing.
So it's learning. The AI-powered part means it can adapt.
That's the idea. It analyzes the info users give, things like age, weight changes, how the child is feeding, any symptoms they see.
Right.
And based on that, combined with its training data, it makes that initial assessment and potentially gets better, more accurate over time as it sees more data.
And the language aspect seems crucial too. They mention training it in multiple dialects and languages.
So important for actually connecting. It's not just about literal translation, is it? It needs to be clear, culturally right.
Yeah, they found something interesting in testing, didn't they? About asking about weight.
Oh, yeah. That insight about culturally sensitive prompts. They learned that asking directly about weight might not work well everywhere.
Right.
Sometimes asking about, like, the child's energy levels or how active they are is actually a better way to get useful information in certain communities.
Fascinating. It shows the importance of that local understanding. Okay, so let's zoom out a bit. The bigger picture here. Nourasense has a pretty grand vision.
They really do. They talk about revolutionizing pediatric care. Their words: smart, scalable, and deeply human-centered technology.
Human-centered. I like that.
They frame it very much as a mission, aiming for child health equity globally.
And the rollout strategy. They're starting carefully.
Seems so. A beta launch first in specific regions across Asia and sub-Saharan Africa.
Places where WhatsApp is common, but maybe healthcare access is patchy.
Exactly. High penetration of the platform, but potentially significant need for this kind of support.
Which brings up a key point about making this work long-term, scaling it.
And Nourasense seems very aware they can't do it alone. They really emphasize needing partnerships.
With who?
Governments, NGOs, hospitals, and critically, the caregivers themselves, the parents, the families.
Right. It really drives home that the tech, however clever it is only part of the solution.
Totally. It needs to fit into existing health systems, be supported by collaboration on the ground.
And their call for feedback and support suggests they know it's an ongoing process.
Yeah, it feels like they're positioning it as a collaborative effort, which makes sense given the complexity of the challenge.
So when you put it all together, the accessibility, the AI, the focus on early detection, it does feel like a genuinely new approach.
It leverages something people already use their phone, WhatsApp, to try and tackle this massive global health problem.
Okay, so wrapping up our deep dive for today, Noura-Bot seems like a remarkably simple idea on the surface.
Deceptively simple, maybe.
Yeah, but potentially really impactful for addressing child malnutrition, using WhatsApp for early identification, getting support out there.
And I think that combination, the user-friendliness, how easy it is to start, plus the speed, getting that first risk assessment in under 5 minutes.
That speed is key.
That really could be a game changer for reaching populations who might otherwise fall through the cracks.
It definitely makes you think. You know, considering how widespread platforms like WhatsApp are, what other big health challenges or even social issues could we tackle using similar tools? Accessible, AI-powered support delivered right to people's phones.
That is a great question to ponder. The potential applications. Well, they could be vast, couldn't they?
Really makes you wonder. Okay, well, that brings us to the end. The sign-off from Nourasense is quite nice. Nourasense for every parent, everywhere.
And thank you for believing in a world where technology nurtures.
A hopeful note to end on.